you know, we've had the Philippine AIDS Prevention and Control Act for some years already. What is different about this?
One of the striking idea in this particular new law is the approach on the AIDS HIV epidemic, as you called it. Basically, titingnan natin yung pag-address ng concern sa AIDS, HIV both on two sides. Basically, itong batas na ito, naka-anchor po siya on human rights. So basically, karapatan ng bawat isa sa atin at karapatan din ng mga tao who are infected, people living with HIV, ang pinoprotektahan natin. But at the same time, we're looking at it also from a health policy perspective. It's a public health issue as well. That's the reason why kailangan nating palakasin, paigtingin, bigyan ng tamang aproprasyon o tamang budget na kinakailangan nung pag-implement ng programang ito dahil tinitingnan natin siya sa public health issue.
But I mean, linawin lang po natin, no? The Act of 1998 really was looking at prevention and control. Tama po ba?
Yes.
And this one really focuses naman on persons living with HIV and
Pareho.
AIDS. And
So, binabalanse niya yung pagtingin. So, makikita natin dito, Robbie, is Ami, yung mga salient provisions niya, most of the provisions dun sa nauna, in-enhance dito, with a tutok, paulit-ulit niyang binabanggit on the protection of the human rights, protection of the rights of those people living with HIV, as well as protection of the people. Kaya kailangan magkaroon ng malinaw at malalim na information dissemination in order to protect the public.
bakit po ba? What was the particular problem or phenomenon that we've noticed over the past 2 decades that that really pushed our legislators to say that no, we need an additional law, we need to enhance the human rights aspect here?
Basically, makikita mo dito kung ano yung mga salient provisions na in-enhance natin dito sa provision na ito. First, with respect to the membership ng council, because we still maintain the council. Ang nangyari doon sa una, napakarami actually yung membership, 26. Dito binawasan na. And as is always the case, kapag marami yan, usually hindi nakapag-meeting. It used to be a consultant with the Department of Health. And umuupo rin ako before with this council, madalang silang magkaroon ng meeting in order for them to be able to adopt a policy. Kung ano yung programa rin. Policy, then comes the programs. Madalang silang makapag-meeting in as much as masyadong marami yung kailangan mong imbitahin. Number 2, with respect dun sa idea, the evolving capacities of a child, between confidential lahat kasi yan, at the same time, yung testing, at the same yung results. Ngayon, kailangan mo ng written consent before a person will be able to undertake a testing, HIV testing. Dito, kapag below 18, before, hindi yan pwedeng mag-take ng testing without the consent of the parent or a guardian. Dito, kapag 15 to 18, pursuant to that evolving capacities of a child, pwede na siya on his own, for as long as may consent siya. Then, below 15, but that particular person is pregnant or engaged in a risky behavior, pwede pa rin siya for as long as there's that particular licensed social worker na mag-a-assist sa kanya. Bakit mahalaga ito? Dahil napansin natin na doon sa mga nagkakaroon ng mga nagkaka-contract o nagkakaroon ng exposure sa HIV, usually maaga pa lang na-expose na sila. And medyo mahaba-haba yung gestation period. So by the time na malaman nila, medyo advanced na. At the same time, baka mas marami nang na-infect because of that particular infection that he already has. At ayaw nila usually na humingi ng tulong or ipaalam sa mga magulang bago sila magpa-check. Yun yung isa sa mga nagiging hindrance. Kung bakit hindi pa sila early nagpapa-check, because they would need consent from the parents, approval from the parents. So mag-aantay muna sila by the time that they turn 18, saka sila makakapagpa-check up, makapagpa-testing. Dito, ina-address natin yung concern na yun. Third item, makikita rin natin dito, malinaw na yung appropriations. Doon sa nauna na batas natin, ang appropriations ng implementation nito, nakapalob siya sa appropriations ng Department of Health. Pero dito, nililinaw na natin, may separate appropriations yan. And yes, attached sila under the Department of Health, but they should have a different allocation, appropriations, para ma-implement nila ng maayos yung mga programs. From the policy, bababa sila sa programs. And the same time, isa pang salient provisions din ito, malinaw na kino-cover na siya ng PhilHealth. Before, nagiging concern kung covered pa yan ng PhilHealth kapag nagpa-check up sila ng pa-testing, tapos paano kapag may sakit sila, is it covered? Dito, klaro, na yung PhilHealth, may coverage, of course, may universal healthcare na po tayo ngayon, but at the same time, kinaklaro rin dito, malinaw na covered yan, including yung testing.